In the past few months, outbreaks of canine influenza have caused shelters and vet clinics and grooming shops all across the country to shut their doors from days to even weeks to allow time to thoroughly sanitize and clean. Sadly, some dogs have died while others have had to be euthanized because of the severe illness from this highly contagious disease. Now, if you're thinking to yourself, I never heard of this disease when I was younger, you'd be right. In 2004, the first cases of an unknown respiratory illness in U.S. dogs was initially reported in greyhound kennels. The culprit, the H3N8 virus, was a horse influenza virus that had jumped species. In 2007, an avian virus was identified in dogs coming from China, Korea, and Thailand. The importation of rescue dogs from these countries into the U.S. is believed to have introduced the virus here in 2015. Since then, H3N2 has been identified in 30 states and growing. It's this particular virus that's been causing the very severe illness that we've been seeing in the past couple of years. The canine version of H3N2 is not the same as the human version. To date, there are no reported cases of a human getting the canine H3N2, and the probability of that happening is extremely low. Canine influenza is spread through aerosolized droplets from dogs coughing or barking or sneezing. I was at an outside dog show a few weeks ago and we were showing under a tent. It had been raining the night before, and as the sun came out and was beating down that morning on the tent, it was causing the moisture from under the tent to aerosolize, and I just happened to be standing at the right position to see through the tent in this particular spotlight of sun that I could see this happening, and it really brought home how droplets can be aerosolized and breathed in, because if I had moved one step either direction, I never would have seen this, but I would have walked right through it and breathed it. And that's how dogs, or even us humans, catch viruses in the air. Canine influenza can also be contracted from contaminated surfaces, like shared water bowls at an outdoor restaurant or brewery, or forgotten toys at dog parks. The incubation is 2 to 4 days from the date of exposure. Due to being highly contagious, if you have multiple dogs in your house and you bring a dog in with the canine flu, it's probably going to spread to all your dogs, and it's going to happen within a matter of a couple of days. If your dog does get canine influenza, you might exhibit some of these symptoms. A dry or even a wet cough that lasts a long time, like 10 to 21 days, sneezing, yellow or green discharge from the nose, an eye discharge, labored breathing, lethargy, a decrease in appetite, and a high fever of like 104 to 106. These symptoms can come on really fast. You may go to bed one night, wake up in the morning, and all of a sudden your dog is coughing. Or you go to work one morning and the dog's fine, but when you get home that afternoon, he's laid out with a fever of 105. Of all the dogs that get canine influenza, about 20% you won't even know that they're sick. They're just simply asymptomatic, but they're still shedding the virus. 80% of the dogs that do show symptoms can range widely from very mild symptoms to extremely severe symptoms. The real danger of canine influenza is that it so suppresses the immune system that a secondary bacterial infection can set in, causing a hemorrhagic pneumonia that results in the death of about 5% of patients. Very young and old dogs, as well as dogs that are compromised by heart conditions, obesity, and chemotherapy, seem to be the hardest hit, but young, healthy adults have also passed from the flu. One of the best practices to avoid getting the canine flu is to keep your dog away from dog parks, doggy daycare, kennel boarding, grooming shops, pet supply stores, and training classes. If you're in an area that's not affected yet, you still need to use caution. With the ease of interstate transportation of personal dogs, even these non-affected areas are still at risk of an infectious outbreak. The very best protection you can give to your dog is the bivalent influenza vaccine. Many veterinarians only carry the H3N8 or the H3N2 vaccine, so do call ahead to make sure they have the vaccination that carries both of those strains. The vaccine is given in 2 doses, spaced 2 to 4 weeks apart, and then boosted annually. And then full immunity doesn't kick in until about 2 to 4 weeks after that second vaccination. Just like with our own human influenza vaccine, the canine influenza vaccine will help prevent the dog from getting the flu, but if it still does get the flu, the severity, the duration, and the symptoms won't be so bad. If you suspect that your dog has the flu, the first thing you want to do is call your vet and advise them and see about making an appointment. Do not just show up at your vet clinic, walking through the door with your sick dog and potentially exposing all their other patients. All vet clinics have a protocol in place for isolating and examining patients that come in with potentially contagious diseases. This might include your vet coming out to your car to do the exam, or possibly you going around to the back entrance to come in. While you're at the vet clinic, keep in mind that this can be spread by contaminated surfaces and you are a potentially contaminated surface. So don't be reaching out to pet other people's dogs, and advise people to keep their dogs away from you. You don't want them coming up and smelling you and picking up the virus that way. Your vet can do a very simple nasal swab to find out if your dog actually does have canine flu. Since the canine flu is caused by a virus, treatment's going to consist of mostly supportive care, such as reducing their aches, pains, and fever, or supplementing hydration through the use of IV fluids. In severe cases, if your dog is having trouble breathing, they may administer oxygen therapy. Antibiotics are only going to be prescribed if they suspect that a secondary bacterial infection might also be in the works. If your dog does have canine influenza, you can expect it to be about a 2 to 3 week recovery. Dogs that do have the H3N2 virus are contagious for 26 days. So you want to make sure that you keep your dog at home for that period of time, plus a couple of extra days, even if your dog seems perfectly fine. And if you have other dogs at the house that seem to have not gotten sick, you still want to keep those dogs contained at the house as well for that length of time, because again, about 20% of these dogs that have the virus don't have any kind of symptoms, but they're still spreading the virus. If you got value out of this video, I hope that you'll hit the like and subscribe button, and then you can click on this picture and it'll take you to the next Doberman Way video.